Abnormal involuntary movements, recognition and description. A 65-year-old man presents to the Neurology clinic with an abnormal involuntary movement in both hands, which started gradually about 3 years ago and has steadily worsened. The movement is rhythmic and oscillating and is alleviated when his hands are at rest, but is aggravated by emotional stress and fatigue. It is severe enough to disturb his daily activities. He is currently not taking medication. The patient reports a family history of tremors. How should we describe these abnormal movements, and what are the diagnostic considerations?
Movement disorders comprise a vast array of conditions and encompass tremor, dystonia, chorea, tics, Parkinsonism, myoclonus, and ataxic syndromes. Causes include lesions, infections, paraneoplastic, neurodegenerative, genetic, and many other processes. Let's explore the different types of abnormal movements. Involuntary movements can broadly be categorized as hyperkinetic and hypokinetic movements. Hyperkinetic movements involve excessive or additional movement, while hypokinetic movements involve decreased activity. Common hyperkinetic movements include tremors, dystonia, myoclonus, chorea, and tics. These movements can be further subdivided by their voluntariness, rhythmicity, pattern, and texture. Tremor, which is defined as involuntary rhythmic oscillating movements in a part of the body. The subtypes of tremor include resting tremor when the muscle is relaxed, and action tremor, which can be subdivided into postural tremor when holding a posture, and kinetic tremor during purposeful movement. Dystonia is described as muscle contractions that can be sustained or intermittent and cause abnormal posture or repetitive movements and can be tremulous. Dystonia can persist and force the body into prolonged, often uncomfortable positions. It can be classified according to the number of body regions affected into focal, segmental, multifocal, generalized, and hemidystonia.
Myoclonus is a sudden brief involuntary muscle jerk and can be focal, multifocal, or generalized. Examples include hemifacial spasms and hiccups. Chorea is defined as involuntary random, irregular, purposeless movement that flow from one body part to the next. These fragmented and unpredictable movements may involve the limbs, trunk, neck, face, and tongue. The intensity, frequency, and amplitude of chorea can range from subtle low amplitude movement of varying frequency in the upper face to severe large amplitude movement in the limbs and trunk. Tics are sudden, rapid, semi-voluntary, stereotyped motor movements or vocalizations that are often repetitive and commonly seen in different conditions. Tourette syndrome is considered a type of tic disorder. Examples include blinking or throat clearing. These typically are associated with premonitory sensations and a sense of relief following the movement.
The other broad category of abnormal movements are hypokinetic movements, which are defined by a reduced frequency or amplitude of movement. An example is bradykinesia or slowness of movement, seen in Parkinsonism. These patients might be unable to start a task or even move from a stationary position, such as with freezing of gait. Finally, there are abnormal involuntary movements outside these two broad categories. Ataxia is categorized by a lack of coordination of voluntary movements. Cerebellar ataxia specifically refers to this lack of coordination resulting from dysfunction or damage to the cerebellum and its pathways. Cerebellar ataxia can manifest as unsteady gait, clumsiness, and difficulty with precise motor control, including in the eyes. When you see a patient in the clinic with abnormal movement, first determine if the movements are hyperkinetic, hypokinetic, or ataxic. Our patient has excess movement, which is hyperkinetic. Because his movements are rhythmic, oscillatory, and predictable, his movements are tremors. Given that his tremors occur with action and familiar, he likely has a condition called essential tremor.
For more information about abnormal involuntary movements, how to be diagnosed clinically, and how to be managed, please see the course resources. For more information on the neurologic conditions associated with these movements, please visit aan.com/NeuroBytes.